and the most obvious structure is the left ventricle. Okay? The left ventricle is the biggest compartment. Why?
Because it has to
Pumps blood.
Pumps blood to the whole body. Good. So this big compartment is the left ventricle. Here's the right ventricle. The left and right atria are contained here inside the auricles. Auricles means ear. They look like little puppy dog ears. Okay, and the atria are inside that. All right. So when you're looking at the vessels, you want to think where it's coming from. Okay. So first remember that arteries are thick-walled because they actively pump blood. Okay. Veins are thin-walled because they're passive transporters of blood. So your artery and your pulmonary trunk, your aorta and your pulmonary trunk are both going to be thick, and your superior and inferior vena cava are both going to be thin. Okay? So what vessel comes from the left ventricle to the body?
The aorta.
Okay. So here's the left ventricle. It goes up through this vessel, which immediately branches, which we know the aorta does. So this is going to be your aorta. Okay?
That whole thing.
Yeah, this whole thing right here. Alright? Well, after it branches, the name changes, but that's as far as you need to know. Okay? The right ventricle goes to the lungs by what vessel? Pulmonary trunk. So, if I stuck my finger through the vessel here, it would come out around here. Okay? Which my finger's not long enough, but that's okay. So this is your pulmonary trunk. So I know you guys already talked about this in class. When you're listening for the vessels, you hear the pulmonary trunk on, let's see, to the left, on the right side, right? Why is that? It's because it crosses. Okay? So your right ventricle, the pulmonary trunk crosses over to this side. Alright? Okay, let's see. This stuff. This is our right atrium right here. So if I stick my finger in here, I'm going to come out on two vessels. This one is your superior vena cava, and this one is your inferior vena cava. Okay? They're really thin. They don't stay open. They're just like floppy. Okay? The other things you have to know are the valves. So what valve goes from the right atrium to the right ventricle? Tricuspid. So here's your tricuspid valve. It's attached to chordae tendineae, which hold it to the papillary muscle. Okay? Down here.
Where's the valve?
The valve is just the floppy skin part here. Yeah. So this valve is a little bit more clear. Which valve is this one? Bicuspid or mitral valve. Yeah. Also attached to chordae tendineae, which attaches to the papillary muscles here. Okay? The other thing you have to know is the myocardium. It's a muscle around the heart, and the interventricular septum, which means wall between the ventricles. Right? And that's it. Cool?
So we don't have to know any of the outside?
No, because you can't see very clearly. Okay? But on the model, you have to know everything on those figures on the model, okay? Because you can see.
So you're either going to use that or the heart model?
Right.
I prefer that one.
Okay? So you guys can look at these.